About 3 months ago, I found out I have Hashimoto's and in the process of trying to conceive. My functional medicine doc has put me on LDN and said 4.5, but I never really had any pain yet as I'm still subclinical TSH and not very high TPO, which is an antibody. So I decided to do just 3 milligrams for now for 3 weeks on LDN. Should I stop since I'm trying to get pregnant or stop while pregnant? My fertility doc wants me to stop since there's not a lot of data, and I also want to keep my body healthy during pregnancy. Okay. Let me ask this. We use low dose naltrexone for sequestering or decreasing antibodies such as the thyroid peroxidase, which is the TPO, but also thyroglobulin. Not everybody is 100% Hashimoto TPO. Usually there's some thyroglobulin in there as well. So I would definitely have that antibody looked at as well. And that's why people have kind of a roller coaster, low thyroid, high thyroid, low thyroid, high thyroid. That happens very common with Hashi. But once you get pregnant, the Hashimoto's doesn't go away. So I'm not sure why we would stop the LDN. Dr. Philip Boyle has treated, to my recollection, over 4,000 patients in Ireland, I believe, definitely over in the UK, using low-dose naltrexone for women who are trying to conceive. They've used it during their pregnancies, and the data that he shows is that pregnancies, help me out here, Linda, the pregnancies were healthier and the babies were healthier in his data, correct?
Exactly. And he always said many babies when they're born, and I have to believe what he's saying, have to have antibiotics. They can have chest infections, things like this. The mothers who have been taking LDN during pregnancy, the babies generally don't ever need antibiotics. They're really, really healthy. They're a very good weight. They meet all their markers and they're very contented. And if my mother had taken LDN, she would have been delighted. I was born 5 weeks early, and apparently for that 5 weeks, I cried the whole 5 weeks until my due date, and then I was happy. She got to the stage where she would feed me, change me, put me in the pram down the bottom of the garden, go inside and close all the windows because I just wouldn't stop crying. But one of the interviews, I know I'm going on here, but it was so memorable. He said he was talking about LDN and how it's amazing in all his patients. And then he said, but it's addictive. And I'm thinking, why is he saying it's addictive? It's the opposite. For me, he took a pause. It's addictive for me because I can't wait for the next patient to come in who's trying to get pregnant, but she's also got Hashimoto's. And I think to myself, I can help her. I can help her Hashimoto's. So he was wanting to help more and more patients, not just the patients that come in with infertility problems, but it's not only infertility problems. He helps women with painful periods, heavy periods, endometriosis, polycystic ovaries, the whole women's health.
Women's health, yes. Really, and you can find his stories on YouTube, actually. Dr. Phil Boyle, Boyle. And he's delightful to listen to begin with. But his slides are right there too. And if I remember right, it is a segment that he presented at a very early LDN conference, I think around 2014, 2015, very early on.
We've also, if you put his name in the LDN Research Trust in the search bar or in search condition data, put in infertility, it comes up with everything, all his presentations. But he's done several presentations, he's done radio shows, he's done webinars, he's done everything. So that's pretty amazing.
And so whether you get to 4.5 milligram is not the issue. It's not that 3 milligrams is going to work and 4.5 is going to do that much more work or better work with Hashimoto. That isn't the issue. It's really about how do you feel on 3 milligram. If you do move up to 4.5, that's a big jump. That's another 50% again. There's a lot of room in between. You just need to either get a liquid so you can manipulate that dose a little bit or get smaller capsules to play around with that dose. And in the US, it's my professional opinion that some providers who haven't read the data, who assume that there's not a lot of data out there, don't want you to be on something because this is a very litigious country, unfortunately. We all want the same outcome. We want healthy mamas. We want healthy babies. We want wonderful, healthy families. I've been a pharmacist for 37 years, and I have literally seen LDN work where women have had decades of infertility. So case in point, this was probably, oh my gosh, this has been at least almost 20 years ago. This mama comes in and she's a veterinarian, so she's very well educated. She has very thin scalp hair. She's very much built like a pear. She's had thyroid disease. She's got the outer third of her brow gone. She's very full with mucin through her cheeks. And you can just tell that she's not functioning at her full capacity. And she was told when she was 19 that she had a luteal phase defect and that she was going to have a problem getting pregnant. She tried Clomid. She tried all these other things. Well, we did a hormone test, and we found that her luteal phase defect is that she was low in progesterone around, day 21 or so. So her doctor prescribed some progesterone for days 14 through 28. We also helped with giving her some T3 so that we could optimize her thyroid status. And she actually conceived, and it was a beautiful moment. Well, then 2 years later, she wanted to conceive all by herself without the help of a lot of other things. So she did use progesterone the first 16 weeks, additional progesterone the first 16 weeks of the pregnancy to maintain, because she wasn't making enough progesterone. But that is very common in women of any age, whether they are diagnosed with a thyroid condition or autoimmune or anything. American women were seeing lower and lower luteal phase progesterones, where day 14 through 28, they're just not making a lot. So Hashimoto is very important to get around and to control, but it's also very important to take a look at hormone status. We're not just one compartment and another compartment. Everything comes together as a beautiful symphony, and that's what makes for a very healthy pregnancy and very healthy babies at the end. So I would definitely continue. I would definitely go out and look at Dr. Phil Boyle's information. I also want to clarify what is a lot of data, because we see a lot of prescriptions written when the control groups or the data published with that commercially available medication is centered around a population of 50 to 250 people. So there's that. In my professional opinion, I don't have any issues with LDN being taken during pregnancy or even to try to get pregnant. Not at all. Contact me if you have any other questions. Happy to help.